everyone. My name is Brianna Contreras, and I'm Associate Editor of Managed Healthcare Executive.
And my name is Peter Werwein, and I am Senior Editor of Managed Healthcare Executive.
Today we have Perry Cohen joining us today for our latest episode of Meet the Board series on the Tuning Into the C-Suite podcast. Perry is not only a member of Managed Healthcare Executive's Editorial Advisory Board, he is CEO of the Pharmacy Group, which provides services to associates, healthcare and information technology organizations, payers, and pharmaceutical companies. So thank you for joining us today, Perry.
My pleasure.
All right. So before we get started into, more of the big clump of the conversation, can you first just tell us more about the Pharmacy Group? Tell us about the Pharmacy Group and what it is that you do there, and maybe kind of how you got to where you are today. Maybe a small little snippet, if you could.
All right. Well, the Pharmacy Group's been around for 23 years. It was started originally to manage the cost of the pharmacy benefit by a group of pharmacists in 1997. And it evolved past that to now it's a group of 5 companies, 2 of which still manage cost of the pharmacy benefit for clients, health plans, employers, and the other 3 companies help vendors grow revenue in the payer space. So it's 5 companies, and we're 23 years old. As far as my past, I'm a pharmacist. I've worked in managed healthcare for now 40 years for mostly health plans. I helped create Aetna's PBM in the early 90s, so I know a lot about the pharmacy benefit space. And currently I'm helping certain clients with innovative projects to change how pharmacy is practiced in the United States. And I can honestly tell you, in 2021, pharmacy has never been crazier or hotter. It's out of control.
Unbelievable. So how long have you been a board member with Managed Healthcare Executive?
I'm going to say 1994. I'm kind of a dual agent. I'm on Drug Topics Advisory Board and I'm on Managed Healthcare Executive. So it was both kind of mid-90s type of thing.
How would you feel if I told you that was my birth year?
Oh, well, there you go. I could be your father.
That's pretty awesome. That's a good year.
There you go. There you go.
Bree, I don't like you playing the youth card on us. So
I just thought, it'd be a fun topic to share, maybe.
Yeah, well, that's okay. I have a daughter who was born in 85. So
yeah.
She's
very cool. Very cool.
So Perry, when you say it's hotter and wilder than ever, could you just elaborate on that a little bit? What is sort of going crazy in the pharmaceutical sector?
Right. So when I look at the world, it's really simple. There are pharmaceutical companies and there are patients. Drug companies make drugs to help patients get better, treat disease, and that's the world as we know it. Between drug companies and patients are all this infrastructure: physicians who prescribe, pharmacies who dispense, wholesalers who move things around, and that's just the delivery of healthcare. Then on top of that, you talk about financing. So on the delivery side, on distribution at the retail pharmacy level, there's something called Amazon out there being disruptive. CVS bought Aetna, so is it a payer or a provider? So a lot of those dynamics are happening. And from a Wall Street perspective, it's simple, but these companies have bit off more than they can chew in a lot of ways and never digest it properly. And you see waves of consolidation and then fragmentation, and then consolidation and fragmentation. So for example, just as the pharmacy benefit industry has 3 major players, CVS, Aetna, Express Scripts, Cigna, and Optum United, there's a whole cadre of new generation PBMs that are being launched. I actually wrote an article that was published in your publication last July on the next generation of PBMs. All these startups that are really technology companies that are managing the pharmacy benefit. At the same time, health plans are going through the exact same change. I'm a health plan guy. I've been doing health plans for 40 years. But if you talk to the people at Bright Health Plan or Oscar or Clover, they've got a whole different model where they're technology first, consumer second, and we'll fill in with the pieces, which, adding a hospital, adding a doctor, whatever. And then there's digital pharmacies out there where you see ads on TV where you can buy erectile drugs or whatever and just click this and go to your website and order stuff. So for the consumer, there's a lot of ways to access healthcare now, digitally and in person. And then the COVID-19 just accelerated the movement of that for some people. And then the last issue is financing of healthcare. Government, Medicare, Medicaid, commercial, right, employer-based, and then the individual market. Regardless of who's the president and whether it's red or blue, technology is changing healthcare. And the thing you have to remember is healthcare is an information business first. And I'm a pharmacist. And I'm like, wait, it's a patient care business. No, it's information. And all the information is available digitally now. So all these things are kind of coming together. And then at the highest level, because we're talking about healthcare, are physicians. And we're seeing a generational change in physicians and healthcare. If you talk to any physician, just ask them how old they are. If they're over the age of 60, they want to get out. If they're under the age of 40, they're following fine. And those physicians between ages 40 and 60, regardless of their practice or their specialty, are very frustrated / angry. And so when your doctors aren't happy, healthcare is not going to, work right. And a lot of us tend to move around that.
And that cohort that's angry, is it because they were trained in a healthcare system that was organized differently and maybe not so technology driven, and all of a sudden they're facing a changed world that maybe they're not, that they think that the healthcare isn't the quality that it should be?
Well, think of it first as going from a cottage industry to a real business. The analogy people have told me is back in the 40s, the pilots used to own the airlines. Now the pilots just fly the planes. And healthcare, healthcare, the physicians are the pilots. And it's going from a cottage industry to this consolidation, from individual practices to group practices getting bought by Optum and other players. And so there's a lot of consolidation from an ownership of the practice of medicine. And it's frustrating for doctors. And then the other thing is what they call cookbook medicine, where they want to, health plans want them to follow protocols and guidelines and just be a drone. And so the fact that you can't be an independent businessman and you can't practice the art of medicine, they're making it more repetitive, makes it less interesting. And it wasn't what a lot of doctors signed up for 20, 30 years ago. And now they're kind of mid-career physicians, and they're like, wait a minute, this is not right. So you see some doctors, for example, going to Canada, where they pay primary care doctors more than they do in the US.
Right.
So you see a lot, there's so many dynamics in healthcare, delivery and financing, role of pharmaceuticals, pharmacy benefit. It's just, I think it's frustrating for a lot of people right now.
Just one more question, then we'll get a little bit back on script. So if you sort of divide physicians into three groups: the over 60 crowd that wants to get out, the the people in the 40s and 50s and early 60s who may be angry but can't get out quite yet, and the under 40 crowd that's kind of grew up in the current.
And I'll call that group employee physicians.
Employee physicians.
Yes.
You're a pharmacist, and it seems with regularity we talk about pharmacists playing a larger role. So could you sort of apply that same sort of thinking to pharmacists? Can they be divided into those that want to get out, those who are angry, and who are employees?
Yeah, probably the same dynamic, generational change in pharmacy practice. I'm 66, so a lot of pharmacists that are my age that were retail pharmacies or hospital pharmacies, they're kind of burnt out. They don't like the practice anymore. It's too regulated, too much automation. It's not, it's not the same professionally satisfying they bought into. Those below the age of 40, they got in, they just follow the rules, they do what they're told, they plug into computers. That's what they were raised on. And those between 40 and 60 are trying to either reinvent themselves or just marking the calendar till they can, basically retire. So it's happening. I think dentists, a lot of them a lot of healthcare professionals are feeling this with the changes in healthcare. That being said, for those of us who are 2 standard deviations from the mean and try to innovate, we're as excited as we can be because there's so many new things we can do now, because a lot of the repetitive tasks of pharmacies have been automated and or given to people like pharmacy techs to do. So now pharmacists are forced to do the real value, which is to be medication therapy management experts and use your clinical skills and your patient skills to make sure drugs are used appropriately.